Sim Physio YouTube channel. Today's video we are going to be looking at coccydynia. Coccydynia is when we have pain in the coccyx bone. This is the small triangular bone at the base of the spine. It has a key role with regards to muscle attachments, particularly of the pelvic floor, and ligamentous attachments, as well as stability and movement around the pelvis. What can happen typically with coccydynia is there's a couple of different causes that can trigger pain. One can either be traumatic, either internal or external, internal with childbirth or external falling onto the coccyx. It can also be idiopathic, so it can come on for no apparent reason, as well as referral from other conditions, potentially a disc prolapse, issues with any of the surrounding musculature, for example gluteals or piriformis, or other conditions around the pelvis, such as SIJ capsulitis, can refer into this area. There are different gradings with regards to injury to the coccyx. If it's very minor and straightforward, typically takes between 6 to 8 weeks to resolve. What we're going to look at today, when it's very simple and straightforward, we're going to be looking at the key exercises to get the pelvis moving, relax around the area and strengthen the pelvic floor. So I strongly believe with coccydynia, you have to get it assessed properly first and have the severity diagnosed even before starting this video. Based on the fact that it's come back mild or with no complications, you want to start to look at regaining movement. So you can either go back into a normal child's pose position, or if it's relatively comfortable, you can bring the legs out slightly wider and then stretch back. The idea is you want to open up through the SI joints and you want to decompress through the lower spine and open up through the lower part of the spine with the coccyx. By doing a cat-cow movement now, that also starts to regain mobility through the whole spine, because you think the coccyx is the lower part of the spine, so you want to move all elements as one. So doing a normal cat-cow, and then what we want to do next is obviously leaning back into a stretched position. So as you're going side to side and arching back, you're gently trying to tease in movement through the pelvis and into the lower back together. We then want to look at movement of the surrounding structures, so into the hip joint and the pelvis. So first of all, just bringing the leg up straight into a flex position. With each movement, there's no set amount of reps, looking approximately between 10 to 15 reps, but you just want to regain movement. Turning the leg outwards slightly, we can then start to target the SIJ with a little bit more, so sacroiliac joint. Again, aiming between 10 to 15 reps, and then moving into hip circumductions. So we want to look at movement through the whole area. So just think with coccydynia, we want to get the whole area moving. 10 to 15 circles one way, and then repeat on the opposite side. And then bringing it up into a decompressed movement. So by moving the whole spine, particularly targeting the lower back, we're working around the area of pain. So you want to move through the whole spine, want to oscillate through. So knee hugs and then circumduction with the knee hug can help to massage and move the area to help to regain movement and flexibility. So it's all about regaining movement through the spine and releasing all the surrounding joints. We then want to look at activating through the pelvic floor. So because of the attachments of the pelvic floor into the coccyx, it's key to strengthen around to re-stabilise the coccyx. So pushing the feet together, gently letting the knees drop outwards. As we breathe in, we're going to push the tummy out, and as we breathe out, we're going to pull the tummy in tight, pushing it down towards the floor, and then lifting up through the pelvic floor, holding for 5 seconds. So almost feel like you're lifting up towards your belly button, relaxing and repeating again. So we want to repeat this between 2 to 5 times, gently regaining stability of the pelvic floor.